For those of you who attended college, there was something called a SWOT analysis. SWOT analysis is useful when you're starting a new business. What is a SWOT analysis? SWOT analysis is a strategic planning tool that helps businesses identify and analyze the internal and external factors that can impact their success in business. The S stands for strength, the W stands for weaknesses, opportunities, and the T stands for threats. When you're starting a home care business, you are doing a SWOT analysis in your head, most likely, but many of you guys don't really write out um, the SWOT analysis for your home care business. I have not done it, but it's a tool that can help you identify. So, how does that work for home care? Well, the first thing is strength. In the SWOT analysis tool, the first thing is strength, S for strength. The strength of a home care business is experienced and qualified caregivers who are specialized in specific sections such as dementia, pediatrics, wound care, and things like that. This is home care, not group home, okay? So if your company can attain and retain qualified caregivers, that is a strength, okay? Having a relationship with local healthcare providers. These are relationship with hospitals, clinics, senior living communities, case managers. And when I say relationship, I don't mean taking them out for coffee or bribing them or anything like that. I mean having a professional relationship with them because they have a job to do, you have a job to do, your two jobs intersect. The client is where you both meet. You bring qualified clients, qualified caregivers, and they bring the clients, and you both need each other. So having that relationship is a good strength to have. You should be a provider that's known for providing high quality services. That's a strength. Okay. You should be having a flexible schedule. If you get a 40 hours in 7 days, don't schedule someone 40 hours to work 7 days. No one works 7 days. If a caregiver is getting a schedule of 7 days and they continue to submit a timesheet for 7 days, it's not working. They're not working, okay? There's something not adding up. So usually how you beat the system with that kind of schedule is for every 40 hours, you give it to 3 different people, okay? 3 different caregivers, okay, working for that client. You should be able to provide a wide range of in-home services, personal care, companion, medication management, skilled nursing, behavioral health, case management, transportation. Having a license that can provide a lot of services is a strength to have. Okay. Weaknesses. What are the weaknesses in home care? High employee turnover. Weaknesses in home care: high employee turnover and difficulty retaining quality caregivers due to the physical and emotional demanding of the job. This is a physical job. It's a physical care. The cleaning, um, in general, personal care is a physical job. So a lot of people don't want to do it. So that's a weakness to a home care agency. Limited area, geography area, so where you can provide services. I think we beat the system in that. If you have a software that allows you to run your company without your workers ever coming to your office, then that weakness, um, coverage area limited, is no longer an issue. But if you were doing paper business, then you will not be able to cover a large area due to the fact that um, you have to have your workers come back to the office every day, or not every week at least, or you have to hire people. People have to come to your office to get hired, and that's a limitation a weakness that agencies have, but you can beat that by using software. Okay, not having enough money, right? Not having enough money to cover your payrolls um, could be a problem. Okay, lack of brand recognition. You're a small company. A lot of people don't know you yet, so that's also a weakness for home care agency. But um, high turnover, you can fix that. The geography, the coverage area, you can fix that by having a software. Um, um, Brand recognition, you can build, you can work on your marketing, have a good website, so be available on social media and all that. Let people know you. That's what I'm doing, right? Software. So yeah, you can actually you can sell your services yourself without spending a lot of money on it. You can beat that. What are the opportunities in the SWOT analysis for home care? Grow. There's a growing demand for home care services as people get older. Okay, and there are more seniors who will prefer to get service in home. Okay, they call it to age in place. Okay, expansion into new service lines such as specialized services, skilled nursing, transportation, mental health, behavioral health. You can expand the telehealth, remote health monitoring. There's a lot of opportunities that you can provide service to. So that's an opportunity that you can jump into. You can have partnership with hospitals, rehabs, senior centers, physical therapy companies to help you grow, offer more services. Okay, you can use a software that allows you, a technology system that allows you to grow and 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 provide services with the ease of electronic health records. Okay. Uh, there's an opportunity to provide more services and become an in-network services to more insurances. So you can you can definitely get more contracts from more insurances, and also even target private pay, corporate wellness payment, government, Medicaid, and other insurances. But the goal is to diversify your revenue streams and get away from one one company paying you like Medicaid. What are the threats in this? What the last letter is T, threats. What are the threats to home care businesses? A threat to home care business is a competition. Okay, larger companies, even the small companies, are your competitors, and they could take you out, or they can take a big bite of your company. Your manager could take a big bite of your company if they go start their own company. Okay, regulatory changes, reduction in reimbursement rates, um, significantly can significantly impact your business's operations. Okay, a difficulty in recruiting, potential liability risks such as legal or compliance issues, economic downturns, economic downturn, um, change. I'm going to say this one: change in the politics. Okay, a change in politics. If your governor was a Republican, or it was a Democrat and now it's a Republican, that could screw you up. If you don't know that, that could really screw you up, because insurances is a business of government, and if a government changes, a lot of things changes, and those changes usually screw you up. It has happened to me before. So that's SWOT analysis for home care. I'm going to try to do another one for group homes.